Matthew Cooper. I'm a paramedic practitioner and I work at Marden Medical Centre. So I went to University of Hertfordshire in 2009 and qualified as a paramedic in 2012. I then worked for the London Ambulance Service for a few years and then joined the South East Coast Ambulance Service where I worked as a paramedic and then became a clinical team leader. And following being a team leader, I decided to go to St George's University to do my paramedic practitioner course. And following that, I decided to join general practice around 5 years ago, so I've been in general practice now for 5 years. I think there's a few reasons why I decided to join general practice. In my previous job roles, I didn't really get the continuation of patient care. So my main role was to discharge patients from the scene, refer them into hospital, or refer them to other primary care services. So you never got that feedback, you never got that patient journey, yet you only got a very small amount of time with each patient. But in general practice, you get to see patients, follow them up, refer on, get the discharge papers back. And I felt like that would really enhance my development, which definitely has career opportunities in general practice to keep advancing. And there's a big drive for ACPs as well. And also there's a big drive for specialising in certain areas, so you can always enhance your scope if you do choose to. I think the final reason was it's much more family friendly. There's no shift work, so we wanted to raise a family, and joining general practice was a good way of doing that. So I mainly do acute on the day patients, so patients with urine infections, musculoskeletal problems, infections. However, as I become more experienced, I am starting to manage more complicated patients, following patients up. I work with a multi-professional team here, so we all work together. I support the nurses with any patients they find can be challenging if they think a patient needs antibiotics. And I also do lab results, so I can take my bloods, look at lab results, follow patients up after lab results come back in, and also I'm able to refer patients to most secondary care services, so I get most of my own letters back to me as well. Okay, so as a practice, I think multi-professional working is really good for practices, having people who specialise in different areas. I think the workload in general practice is increased over the last few years. Even in my 5 years here, I think that's going to carry on happening. I think by passing the workload to other healthcare professionals allows the GPs to have more administration time and also deal with more complicated patients and do the sort of general practitioner work. So by me doing mostly acute stuff, but a lot of the acute patients, it frees them up. I'm hoping they find that quite beneficial. For patients, I think it's about access for patients. I've always been, patients want access to healthcare, and I think they want an appropriate physician, not always general practitioner. They're quite happy to have an appropriate clinician for their medical problem. I think that shows with diabetic nurses, pharmacists coming in, that patients are quite satisfied as long as they're seeing someone who can manage their medical complaint. So I think for patients, having better access or improved access is great for them, and that's what they generally want. So the First Contact Practitioner Roadmap, it helped my development. I think at the start of it I was very unsure about it. However, if you have good supervisors, which we have here, who are very keen on development, you can actually reap the benefits of it, and rather than being a tick boxing exercise, listening to my phone consultations with a GP where they critique you and talk about how you can do things better, it's definitely shortened my consultations, definitely helped my development. So I think it's one of those things that you get in as much as you and your supervisor get out of it. Just in my first contact practitioner training, so I'm level 2, I'm looking at becoming an ACP advanced clinical practitioner, and I am looking at specialising in a certain area. My work are quite supportive of me specialising in a certain area of medicine. I haven't chosen just yet which area that I'm going to specialise in. Also a multi-professional lead for the PCN, so I'm looking at development opportunities for other staff, trying to help the transition of paramedics into primary care is quite a challenge for them to come into this sort of environment. So yeah, looking at lots of bits going forward, how to improve sort of general practice as a whole.